So some of you may know, or some of you may not know, that the screening test for celiac is called your tissue transglutaminase IgA antibody. And usually, if you get a doctor to order something, that's what they'll order. I was like, no, no, no. You're going to order my anti-gliadin. You're going to order my anti-endomysial antibodies. You're going to order the IgG. So there's this whole panel that you can do. So she ordered it. I was sky high for all of my antibodies, just like through the roof. I was like, yeah, I've got celiac. So next day I was like, I'm going gluten-free because I knew what to do. I knew how to handle it.
Yeah.
Again, I was in a very privileged position because like I know what has gluten and what doesn't because of my training.
Right.
I did schedule with a GI just to talk it through. And she was like, listen, girl, your endomysial antibodies, which for anybody that doesn't know, those are the antibodies that are physically like attacking your intestines and causing like the problem, one of the problems or part of the problem. They're through the roof. Like you can get a biopsy if you want, but like you need to be like gluten free like yesterday. So the only point of doing the biopsy would be if we were worried that you also had another illness in addition to celiac. And I was like, well, how often does that happen? And she's like, well, I've never seen it. So I'm like, okay, you know what? I'm going to go ahead and go gluten free. And if I don't feel better, I'll give you a ring.